Good afternoon. I'm Monica Hendrickson, the Public Health Administrator for Peoria City County Health Department, and welcome to our Tri-County weekly update on COVID-19. For the Tri-County region, we currently are to date at 53,490 cases. That is an increase of 429 over the past week. Peoria now has an additional 233 cases in the past week to bring our to-date total to 27,081. Tazewell County added 148 cases, which brings their to-date total to 20,556, and Woodford County added 48 cases, bringing their to-date total to 5,853. Overall, the Tri-County has 828 deaths attributed to COVID-19. That is an increase of 5 over the past week. That includes 1 male in their 70s, a Tazewell County resident that happened today, as well as 4 additional cases in Peoria, including an additional death today of a Peoria County male aged in their 60s and was also unvaccinated. Currently, we have 552 active cases at home and isolating, which is a decrease from the 626 we had last week, as well as 26 cases that are currently hospitalized, which is slightly up from last week when we were at 23. Our 7-day average is now at 61 cases each day in the Tri-County, and Peoria County stayed steady at 33 cases per day, similar to last week's 7-day average. Peoria County did note yesterday a higher than usual case count, and that's due to an ongoing outbreak at Grandview Memorial Care, and I'll talk a little bit about that later on. This week, Peoria County saw 60% of our cases under the age of 39, with 13% from the 0 to 9 age range, 17% from the 10 to 19, 14% at 20 to 29, and 16% at 30 to 39. We currently have 14 ICU beds in use in the Tri-County hospitals of Unity Point and OSF, and 37 non-ICU beds in use. The 7-day ICU usage has slightly increased and now sits at 17 beds in use, and our non-ICU slightly decreased from last week. We're now at 50. I mentioned the ongoing outbreak that we're working with Grandview Memorial Care on, and I think this highlights the fact that booster vaccinations are very important. The population we are working with was one that was on the initial drive to get vaccines early on because of their higher risk, and they are currently vaccinated. Now, the good news is they're not transitioning into severe cases or necessarily hospitalizations, but they are positive. So again, with the news that's being released today, we are now going to be able to offer not only Pfizer, but also Moderna and Johnson & Johnson once the CDC finalizes their recommendations for boosters. And so I think that's really key to know. In addition to what's being discussed today at the ACIP meeting for the CDC, we also recognize that yesterday our area hospital systems, our FQHC, and our local health departments were able to do a pre-order of Pfizer pediatric vaccine to get it stationed and ready for us when that news gets released. To give perspective, this first go-around, we had a limited number of vaccinations we could order, and we are looking for Peoria County alone. There are 15,000 residents approximately that are ages 5 through 11 that would become eligible once that news releases. Again, there's a lot of movement in our vaccination as well as how this will get released, and I know people continue to call us and ask us, hey, when will I be able to get this? What we do want to discuss today is that process and what it means and how it will kind of roll out. And to help with that conversation today, we have Sarah Overton, OSF Healthcare Chief of Nursing Officer and Vice President of Clinical Services.
Hi, good afternoon. Thanks, Monica. As Monica stated, my name is Sarah Overton. I serve as OSF Multi-Specialty Chief Nursing Officer, and that encompasses our ambulatory OSF medical groups, as well as home care and occupational health, employee health. So just wanted to share some perspective on what we're seeing with boosters. So this includes both immunocompromised and, so that would be what we refer to as supplemental vaccines, as well as the boosters. So we've given approximately almost 2,800 vaccines just in the last few weeks for those who have reached out to us. So as Monica states, as quickly as the FDA, CDC, ACIP really starts to make recommendations, it really operationally creates some impact on us to really move forward very rapidly. So it's taken us a little bit of time. So initially we've been asking for patients to call. At this time, we are pleased to announce that we now have availability through OSF MyChart for self-scheduling. So what I typically direct our patients and our mission partners to do is ask our patients to visit osfhealthcare.org COVID vaccine. There is our landing page that talks about all the criteria in which we're able to vaccinate, starting all the way up to our adult population and soon our younger pediatric population. The medical literature is definitely under evolution, and so we certainly appreciate the patience that our patients and the public has provided us, and we're committed to always being available and vaccinate whenever possible. You know, just a special thanks to our mission partners who continue to actually come in extra and be available for our patients to serve them. We are doing vaccines in all primary care locations, so every single doctor's office has access to vaccines. We think that is really the opportunity. No wasted opportunity versus no wasted dose is really the mantra we've been operating under for several months. In preparation for pediatrics, we, as you all probably remember, we did initially vaccinate our 12 to 16-year-old population in our clinics, and then after a while we moved forward into our schools and partnered with our schools. The 5 to 11-year-olds are a little bit of a different population. So what we've really started to plan is not only did we pre-order based on our patient population, so we've already secured hopefully a pre-order of dose available for us to procure, but we're also trying to ease access as much as possible. So we are planning some events in mid-November where we're inviting our patients and the public to be able to come in on a weekend. Obviously we know there's a lot of working parents. We think parents are a critical piece of this puzzle to make sure that when they are bringing their children in, that they're comfortable and that they get their questions asked. So November the 13th and November 20th are two dates in which we're planning our large Knoxville location, which has got a lot of easy access. It's very centralized. We'll vaccinate any Tri-County patient. And we're looking for opportunity to vaccinate from 9 to 3, hopefully, given that we do get the pre-order in on time. So certainly this could definitely change if anything changes in the decisions at our federal level. But we're starting to begin planning on that. Also really talking about how these vaccines are different. So this is a different formulation. It has a different label. Cap, so we're already starting to educate our mission partners about those differences to make sure that we're doing this as safely and efficiently as possible. So I'll take any questions.
Being that adults still have some sort of vaccine hesitancy to get the shot themselves, are you hearing or noticing more parents actually wanting their kids in a 5 to 11 age range to get vaccinated?
We definitely have. You know, Monica and I talk on a frequent basis, and we're, you know, anxiously watching the news just as other parents. We have a lot of our school nurses and parents calling and just asking. They're asking also for opinion from their trusted medical home and their pediatrician or family internal medicine physician. So we have been supplementing that education as best that we can through our websites. I definitely anticipate some hesitancy in the pediatric population, so we're also working with our children's service line through the hospital to make sure that we're getting that information out and in the public's eyes. Thank you.
Open up to questions as well.
So with Grandview Memorial, what's the ratio of residents that are vaccinated? What's the ratio of staff that are vaccinated? Do you have those numbers?
I don't have those numbers with me currently. I will say, though, that the resident population we are working with was fully vaccinated. And again, this reiterates the fact, and the literature is very robust on this, that, when Pfizer was released, and hopefully today when the news from Moderna comes out too, that over 65 really should be getting those boosters, whether it's going to be the one that they received initially or if they're going to go through the mix and match kind of program. Either way, the importance for that population to really, because of the waning immunity, get that additional booster at this point in time. Because again, all of our long-term care facilities, all of those individuals that were high risk for mortality and hospitalizations and severe illness, that was the first phase that we vaccinated. And so again, thinking of that 6-month period, we're hitting that mark, if not surpassing it. So if you were in that first phase, please, please get your booster vaccine. It's going to be imperative. We're starting to see more and more of those cases come through. Again, luckily, we're not seeing death, we're not seeing severe illness, but we want to make sure that we are not, creating another unnecessary surge.
This is the first long-term care outbreak we've had in quite a while. We haven't heard about them for a long time.
This for us locally has been one of our larger ones that we've had. We had a few cases here and there, very much controlled because the vaccines were able to create that boundary. But this specific situation, there's a lot of additional layers just because of the client base they work with. But our neighboring counties are experiencing the same thing in terms of long-term care facilities. So we are seeing that uptake, but again, this is a highly vaccinated population, so the outcomes are much better than what would have happened if this was an unvaccinated population in this age range. So, again, it proves, one, vaccinations are working, and also talks about the fact that we need to get those boosters.
Can you clarify the number of cases there at Grandview?
It's over 20 currently.
How should I go about that once that does get approved and go through? If I got the Moderna, let's say, or I got the Pfizer or the J&J, should I talk to my doctor about whether I should get the same one again? Does it even matter?
I think it's really important to always, when you have discussions or questions about vaccines, always talk to your doctor or your local health department, a trusted provider that you have. The idea behind the mix and match is the fact that in a different type of vaccine will trigger a different immune response or stimulation to your immune response. So it gives it maybe a possible stronger indication. Now, this research is still very new. The data, they are monitoring it, and as we found out in the past year and a half, data continues to grow and we learn more from it, but it takes time. So definitely talk to your provider first and foremost. The idea about the mix and match, though, not only talks about maybe giving your immune response a different type of stimulant, but it also starts a conversation about how much vaccine we need in our community, right? Like, can we start sharing and producing additional vaccine to send out to different countries that are still going and not at the same vaccination rates that we are as a leading vaccinator? So again, it opens up conversations for how do we globally address this pandemic. So there's a lot of benefits that we're seeing with the mix and match, not only for the individual, but in this response effort as a whole. But if you do have questions, definitely go to your provider. The research, they're going to, be kind of the same. They're learning as well. What we did see with the research that was presented today, it was that a lot of Johnson & Johnson individuals, may have a stronger immune response if they were to move on to an mRNA vaccine, whether it's Pfizer or Moderna. So that one was very clear in today's discussions that was produced at the ACIP meeting.
People who got that J&J, I think it's 2 months they're recommending, so much earlier than the mRNA 2 dose.
Exactly, and all of that will be very much disseminated and packaged in easy to read information, not only on our social media sites, but on all of our providers in the area, because we understand that that's going to be an easy way for you to access information. And Sarah touched base on this, and I, again, want to make sure people understand there's still steps to go. Even when the CDC director, when she makes her announcement today and this evening, we still all have to update our standing orders or how we do this, make sure that we're properly trained before we can go live. Realistically, I can speak on behalf of the health department. Even if the announcement is made tonight, we're most likely going to be able to give our first booster on Monday morning.
So how does that work logistically for, I guess, the health department, healthcare in general, to be able to mix and match with these booster shots to make it easier?
No, it does not make it easier. Sorry, I'm laughing, Tim, because we were just talking about it outside. The challenge is going to be on a variety of levels. You know, we got lucky with the Pfizer booster program because it's the same dosing. Moderna is a half a dose. Johnson & Johnson is going to be the same dosing. The challenge is we have to keep an inventory of all of our supplies. So all of a sudden, if you can imagine, a Moderna vial that would have given someone their initial vaccine maybe holds 10, and now holds 20 boosters. So we have to make sure we know exactly what we have on hand at every time. You know, Sarah mentioned this too. We live in a world with electronic health records now. So how we input our data and how it's collected is going to be changing. So all that interface has to be updated along with it. So I would strongly encourage individuals, one, to get the booster, but also to actively seek out that information, because it is challenging for us to run a report or an algorithm that will pull you and say, come in and get your booster. It's going to be a lot more of you approaching us using whether it's the OSF site, Unity Point, the health department, and asking us that, hey, I'm interested in it and I'd like to make an appointment or do a walk-in, and then we can check your record and go through that. It's not as simple as it was the first time around, sadly.
And you said even if that announcement gets made tonight, the quickest you guys can do it, roll out those boosters will be Monday. But just for those who are still confused about if they, you know, if they need to get one, can you just go through, you know, who's eligible to get a booster or not?
So in terms of the boosters right now, the eligibility is going to be very similar to what we saw with the Pfizer, which is individuals 65 and older or those with with underlying health conditions. They should get the booster. There is a group that we say may get the booster, which is really anyone 18 or older with underlying conditions, as well as working in high-risk situations where their exposure might put them at a greater risk of getting sick. So think healthcare workers, congregate living settings, jails, corrections, all of that is in that type of grouping as well. So that's really who should be looking to get that booster at this point in time. Now, how and where you get it, it's going to look a lot different than the first round. You know, we had Headington Oaks, and we expect to see an uptake in terms of requests from the health department because the majority of the vaccine we gave at Headington Oaks when we were operating there was actually Moderna. So we do expect a lot more people to be coming out and asking for boosters because now that Moderna will be approved here shortly. So again, we can't necessarily reach out to you, so please come to one of our walk-in clinics. The health department has theirs from 9 to 4 on Monday through Friday. We have additional clinics that are listed on our website as well as the state website, so please take advantage of those.
Is long-term care really being prioritized with the first round of boosters, though? I realize we don't have some of the shortages we used to, but is that really going to be a big priority?
So long-term care has been very much a large priority for getting boosters, and interestingly enough, a majority of long-term care facilities outside of Chicago were Pfizer. So a lot of them were just getting their boosters availability here. They were working with their own internal system that they've had for like influenza vaccines in the past, or they were having state teams go out to them. So they were always going to be a priority for boosters, and a lot of them have been getting those vaccines. But again, this is a time period we're looking at waning immunity, and we want to try to catch people as much as possible. Well, we hope to meet with you guys next week and have even more exciting news to share about vaccinations. So thank you and take care.